All right, good afternoon, everyone. You've gone through many years of higher education, have worked many years as a nurse in your chosen fields, and have gained the title of a family nurse practitioner. You should be proud of yourselves because you are educated to provide excellent health care to a myriad of patients, all presenting with different complaints to all age groups, from neonate to geriatric. But wait a second. You need a doctor to sign off or approve your practice. I am speaking to the current nurse practitioners and student nurse practitioners that are in this unfortunate situation. We are where we may need the approval of a doctor to take care of our patients. In this speech, I will present to you the policy I've chosen to be an activist in. Secondly, I'll explain what kind of an impact we as nurse practitioners can have with an unencumbered scope of practice. And finally, I will talk about how this policy change initiative could be funded. A lot of us, including myself in the future, may always work alongside a physician. But think about the person who lives in an area without access to a physician. This is where nurse practitioners step up and provide care to these individuals. Per the Florida Association of Nurse Practitioners, the Institute of Medicine released a report in October of 2010 that recommends removal of all scope of practice restrictions on nurse practitioners as a way to drive down costs while increasing high quality access to primary health care. The healthcare policy that has been chosen, in which the intention is to evoke change, is the Florida Statute 464.003. This statute defines the scope of practice of a licensed nurse practitioner in the state of Florida. This statute has made several positive changes over the past year affecting nurse practitioner practice, but still has some work to go to allow nurse practitioners to practice to the full extent of their education. These recent changes have changed the Florida nurse practitioner from a certification to a licensed professional. Increased prescriptive authority to nurse practitioners, allowing them to prescribe all drugs, and has specifically defined expanded practice guidelines nurse practitioners can execute when working within the framework of an established protocol. More changes need to be made, and this can only be done by professionals advocating for their profession. In Florida, we have several issues that are mounting to our already established healthcare crisis. Per the Florida Association of Nurse Practitioners, primary care physician coverage in Florida is a problem due to the less than half of them accepting Medicaid and the other half of them reaching retirement age within the next 10 years. Additionally, there are an estimated 3 million Floridians whom have gained insurance coverage after the implementation of the Patient Protection and Affordable Care Act, and people who cannot afford primary care access, consequently resorting to visiting the emergency room, driving up taxpayer costs. So how can these issues be relieved? According to the Florida Association of Nurse Practitioners, primary care access is improved and has reduced healthcare costs by removing restrictive nurse practitioner laws. Less restrictive laws have also attracted more nurse practitioners to the state, which improves economic activity. Nurse practitioners also can save the state of Florida hundreds of millions of dollars annually. So you may be asking, how are nurse practitioners restricted in giving wholesome health care to individuals? Currently in the state of Florida, nurse practitioners are restricted in several areas of full practice. Specific examples include the need of a supervisory physician to approve their practice. There's no requirement of an empanelment of nurse practitioners by all Medicaid HMOs and insurance companies. They are unable to sign a Baker Act. They are unable to sign a death certificate. They are unable to certify DNRs. And they do not have a global signature, meaning they cannot sign all documents regarding patient care. Additionally, there have been studies that have measured the care outcomes and patient satisfaction from nurse practitioners versus physicians. Hoke and Hexon in 2017 published an article that conducted a literature review over the course of 30 years that concluded nurse practitioners provide primary care equal in quality to physicians. And on several indicators, including patient satisfaction, nurse practitioners perform better. All right, so we see the need, but how do we fund this initiative? First of all, we need to be activists. We need to understand the law and why we need to change it. Activists can change several things, from reducing the use of terms that can be insulting to the profession of nurse practitioners, which would be called mid-level providers or any other derogatory term, or to be the voice of opposition when pharmacies are requiring a physician supervisor to be printed on a prescription label when it is not required by law. There are appropriate ways to be an effective activist, which can be done through mentoring, education, and through membership of a professional organization such as the Florida Association of Nurse Practitioners. Parton, in 2006, also stated in their article that professional organizations work tirelessly to change issues like the changes recently done in the Florida statute that I have cited by advocating for the profession. Although membership to such organizations may require a monetary sacrifice of the member, but we as nurses know that meaningful sacrifice is needed to improve the health of is sometimes needed to improve the health of a community. Organizations such as the Florida Association of Nurse Practitioners use representatives that work collaboratively with other corporate, governmental, non-governmental, and other professional organizations toward the accomplishment of their mission. The employment of these representatives can be considered the bulk of the expenditure for the changes that need to be done to such policies. The employment is paid by the professional organization, which will be a member of. So, in conclusion, Hoke and Hexham also state in their article, improving healthcare by securing access to providers for more individuals has been the main driving force to remove the barriers to nurse practitioner scope of practice. Although the Florida statute has had several effective changes over the last year, we still need to be vigilant in advocating for our profession to provide the best care to our patients. Many professional organizations are the funding for changing policies in healthcare, and without our participation, they cannot reach the common goal. We all have chosen this profession to improve the health of our patients and community. We certainly do not need any barriers stopping our efforts to do what we all do best, which is helping our patients.